Hello, good morning, everyone. Welcome, Mr. Professor Amos Korczyn, live from Tel Aviv in my weekly talk show Outlook here on DC News. Mr. Professor Korczyn, welcome and thank you very much for joining me in my discussion in my weekly talk show Outlook. Welcome here once more to Bucharest. How are you, Mr. Professor?
Thank you very much. I'm okay, and I'm grateful for the opportunity to talk to you.
Ladies and gentlemen, I'd like, first of all, particularly since most of the Romanians are not familiar to Mr. Professor Amos Korczyn, to introduce you also to the Romanian audience. Professor Korczyn graduated from the Hebrew Universității Hadassah Medical School in Jerusalem, 1966, where he also received his degree in pharmacology, cum laude, also 1966. He trained in neurology at Bellinson Hospital and the National Hospital for Nervous Disease in London. He was also the chairman of the Department of Neurology at the Tel Aviv Medical Center from 1981 till 2002, and the incumbent of the Seratsky Chair of Neurology at the Tel Aviv University between 1995 to 2010. Besides that, Professor Korczyn has a particular interest in neurodegenerative disease. He has authored and also co-authored over 700 articles in peer-reviewed journals, as well as many chapters in books. He edited several books and special issues in journals and is the regional editor of the Journal of Alzheimer's Disease. And he is also been a member of the editorial board of 20 international journals and organized several neurological conferences, mainly in the field of dementia. And finally, Professor Korczyn is also the chairman of the scientific medical board of the Israeli Alzheimer's Disease Association, the EMDA, and a member of the Alzheimer's Disease International Organization, and has been the chairman of the WFN Research Committee for Clinical Neuropharmacology. That's a very impressive academic track, Mr. Professor. It's such an honor to host you here in my weekly interview. The reason I invited you, besides my intention to get to know you, is also to talk to you in terms of outlook, what we might expect, since several scientists have pointed out at the risk of increasing dementia in society. According to a paper published in the famous The Lancet, dementia is going to rise tremendously by 2050. The category of dementia, as described in this article, is referred to under the name of Alzheimer's disease and other disease. Why are scientists actually raise alarm over dangerously fast growth?
Well, I think that it's a good question, and I think that we should be worried about the increase in the number of people with dementia worldwide. First, let me specify that this increase in the number of patients who suffer from dementia does not mean specifically that. So there are countries in which the incidence of dementia, the number of new cases of dementia, actually gets down, is reduced. But because the number of old people increases, the prevalence, the total number of people who are affected by dementia increases. It is very interesting to ask, why is there a reduction in the number of new cases in some countries? And there may be several causes to it, not just one. And the important thing is that we can now try to find out what are the causes of the reduction. And if we find out what are the causes, then we can do something about it. If we don't do anything, then the future is not good, because so many people with dementia who do not contribute to this society and, of course, demand a lot of attention and a lot of drugs, and this is a big imposition on the economy of many countries. So we should really think hard about what is going on, why is there an increase, and how do we work to reduce this?
Yeah, I mean, it is scaring having such an outlook that actually the cases are forecasted to triple by 2050. You partly said that it is due to a demographic development that will have a larger number of aging population. But what about raising dementia among younger people? Is that also an area of concern?
No, I don't think that there is an important increase among the young, but the number of old people are those of concern to us. For the young people, it's not really an issue of the increase, and still we should know about it.
Yeah, that's very true. On the other side, you also wrote in one of your medical articles that dementia, actually, and Alzheimer are a disease which one should take in consideration and look at the middle of the life before the onset of the disease.
Right. So Alzheimer's disease is a neurodegenerative process, so meaning that the neurons in the brain die slowly, but not in all places, but in the places which are important for memory and for other parts of the cognition. And this goes on for many, many years. Actually, by the time that the patient develops these cognitive changes and is aware that something is going on, this is quite a long time after the disease has started. So maybe 20 or 30 years are going on with neurodegeneration before there are any obvious signs. This is very important because this may give us a window of opportunity to intervene and to prevent the ongoing process.
Now, looking at the reasons, one reason is definitely demography. A couple of weeks ago, Washington Post published an article about Alzheimer and a possible connection to COVID-19. And the author points out that COVID-19 in seniors is linked to increased Alzheimer's risk, is what actually the study finds. And a study using the electronic health record of more than 6 million Americans over the age of 65 found those who had COVID ran a greater risk of receiving a new diagnosis of Alzheimer's disease within a year. So could one explain or argue that part of this tremendous rise in dementia could be linked to COVID-19?
No, I don't think that this is established. This may be so, but we don't have any proof of that. Firstly, the diagnosis of Alzheimer's disease cannot be done right away when a patient comes in. It takes time, so you have to see that the process goes on for a couple of years before you can make the diagnosis. If somebody comes with specific symptoms to me now, and I see them and I ask them, how were you a year ago? And they say, I was okay. It's only after I contracted COVID that I developed it. Then it's impossible to make the diagnosis of Alzheimer's disease. Still, I think that, so although I have not seen the scientific report on which the Washington Post article was based, I think that there is an important issue there. So COVID-19 affected many, many millions of people. And of course, not in all of them, the disease was very hard, hit them very hard. So in many, it was something like a flu. Those people who were affected more severely by COVID-19 are old people, are people with comorbidities like diabetes and hypertension and obesity. And the occurrence of these issues, medical issues of obesity and hypertension and diabetes are also a risk factor for dementia. So, of course, people who had were more severely affected by COVID-19 are also at a greater risk of developing dementia, including dementia of the Alzheimer type.
What about the necessity to look at the definition, actually the relevance of these definitions regarding Alzheimer? I think the definition changed in course of time, and you also pointed out the relevance of definition of Alzheimer. What could you tell us about this definition, since there are quite confusing aspects even among doctors regarding dementia, regarding Alzheimer? What's your good piece of advice regarding definitions?
Okay, so firstly, let us be clear that there are many types of dementia. Alzheimer is maybe a common one, but that's not the only one. There are many types of dementia, of the disorders of the brain, which affect cognition and affect particularly older people. And we diagnose these people as having Alzheimer's disease, some of them, because we see specific changes in the brain. The diagnosis can be established with certainty only by autopsy study, only by post-mortem examination of the brain. But we're dealing with living people and people who at old age who come, and we may think that they have Alzheimer's disease because of the specific context and how the disease develops. But we are right in most cases, but not in all. So this is an issue of the definition. Definition requires the existence of certain specific changes in the brain in order to make Alzheimer's disease diagnosis. Otherwise, we think we call it suspected Alzheimer's disease, but not really proven.
I came across a study indicating that Alzheimer's-like changes were found in COVID patients' brain. What about that? Is there a connection from a neuropathological perspective between the brain of a patient who died of COVID and of Alzheimer? What are the similarities and what are the differences?
No, firstly, we don't have many cases of patients who died of COVID-19 and when were exposed to, were made the autopsy. So there are only limited number. If they have Alzheimer's changes in the brain, then these changes must have developed over several years before onset of COVID. So it's not likely that COVID is an important cause of Alzheimer's changes in the brain until now. But maybe later on we're going to find that people who are exposed to COVID-19 or to other viral diseases are more likely to develop Alzheimer's disease. But again, this means that it will take several years, maybe 10 years or so, to develop the cognitive changes. So I think that at present there's no place for alarm. But I may I may also indicate that the ability for us to prevent COVID-19 and as well as other infectious diseases like influenza is very important, because being affected by problems by COVID-19 or by flu is not good for the well-being of the person, and therefore trying to prevent this is very important.
Well, it is true. It's only we're only talking about small studies, but this research was conducted by Dr. Andrew Marks from the Columbia University, and he said that people who died of severe COVID-19 have brain abnormalities actually that resemble changes seen in Alzheimer's disease, like the accumulation of protein called tau inside the brain cells, and also an abnormal amount of the protein beta amyloid that accumulates into amyloid plaques. That's what these studies have indicated, relating the resemblance between the two diseases.
Yes, as I said, these changes take a long time to develop, and once these people died and were found to have this amyloid and tau changes in the brain, this means that these have probably been there for many, many years before there was the first case of COVID in China. So let me just mention that not all people who have these brain changes are necessarily demented. There may be many, many people, older people, who have Alzheimer's changes and are not demented. And maybe they will become demented in the future, but many of them will not. So the Alzheimer's changes, the neuropathological change of Alzheimer's disease is there, but they not necessarily say that the patients will develop the disease.
Yeah, some scientists also reported actually that the COVID vaccine could prevent Alzheimer's disease. And well, others like Luc Montagnier suggested even the opposite. Why is it necessary for people to vaccinate, even in terms of preventing Alzheimer's disease? We will come later in the second part of our discussion to the insuccess of drugs against Alzheimer's, but now at least related to the COVID vaccine.
Yeah, there's no question that vaccination is important. People die of COVID-19, and particularly those are the people who have more severe disease. As I mentioned, these are the people who have comorbidities, other disorders that, which pre-existed. And of course, these are also exactly the same people who are likely to develop dementia of the Alzheimer's type. So it's very important to really immunize yourself against COVID-19 and against influenza, as I mentioned before.
Could you tell us something, please, about the genetical susceptibility to Alzheimer's and to dementia? What do we know about that? At which extent, for instance, Dr. Gajdusek's studies related to the genetic susceptibility to the transmissible dementia are still valid nowadays?
Right. So firstly, we should separate different types of Alzheimer's disease because there are the young onset, early onset Alzheimer's disease. These are people who develop Alzheimer's disease in the 40s or 50s or early 60s. So there are very few of them, but they are important because in these cases, a genetic factor is prevalent. So a person who comes to me with clinical changes that I suspect of Alzheimer's disease, and if this person is 50 years old or around that number, I always ask them about family history. And it turns out that in many cases, there was a parent or a brother who also developed the disease at the young age. And in these cases, we can identify what is the genetic problem in these patients. It's a mutation in one of several genes that are associated with the possession of this protein, which you have mentioned before, the amyloid beta protein. So these are only a minority of the patients. And if a patient comes and with the changes that are diagnostic or indicative of Alzheimer's disease, who's 70 years old or 80 years old or above that age, then there's no important genetic risk factor except for only one gene which is the apolipoprotein E gene, ApoE gene, which comes in humans in 3 different forms. And one of them is called ApoE4. And people who carry ApoE4 must have received it genetically from one of the parents. And these are people who are more likely to develop Alzheimer's disease themselves. About 50% of patients with late onset Alzheimer's disease have the disease associated with this form of apolipoprotein, ApoE4. So this is an important genetic marker, but still we don't know how it works, and we don't have any therapy which is specific to those people who carry the ApoE bad allele, ApoE4. So it's an interesting observation, but does not have any clinical importance, and no way that this will help us to solve the problem or to cure or to ameliorate the disease in those people.
Well, I think it's quite sad to know, or actually to read, that the Alzheimer's drug trials have had a 99% failure rate. I mean, that's incredible. Billions, I don't know if billions, but huge amounts of money were invested in therapies against Alzheimer, and we're facing now this extremely high failure rate, almost 100%. How can you explain this phenomenon?
Well, I think that you are right. Firstly, this is very disappointing. And as you say, a lot of investment have been made, both economic but also intellectual and scientific efforts to try to solve the problem and to try to prevent the disease. But most of these failures that we're talking about were in efforts to try to eliminate the amyloid beta, the beta amyloid protein that you have mentioned before, which occurs in the brains of PD patients, of Alzheimer's patients. So the idea was that if it's there, let's get rid of it, then the patient will be free of Alzheimer's disease. Unfortunately, this has not been found to be true until very recently, and only very little effect can be expected by eliminated amyloid beta. So I think that this was a false sign. The fact that there is a beta amyloid in the brain is a marker of the disease, but it's not necessarily a player in the disease. So eliminated the marker does not mean that the patient will be cured. And we must look for other targets. For example, inflammation may be an important target, but beta amyloid is a false target. Most of these studies which try to eliminate amyloid beta, in fact, succeeded in getting rid of this protein. However, unfortunately, the clinical situation has not changed.
But how can you explain that not almost an entire generation, but a large number of scientists have followed this track of beta amyloid elimination? Very influential scientists, very reputable scientists. How can we explain this phenomenon? It was almost like a beta amyloid ideology, we shall say, in terms of Alzheimer's disease.
Yes, this is an important point. And unfortunately, we are led we're following the money trail. And if the money to do these studies comes to a large extent from the industry. And it's the industry who says, everybody says that it's amyloid, let's try to get rid of amyloid. And we know that several other companies try to eliminate amyloid, but maybe we can do it in a better way. So they invest money, they tell us, do some studies with our drug, and we'll pay you a lot to try to, with the hope that they will be able. So I think that this is not the way to work, and unfortunately, the price that was paid was investment of so much money in the wrong track.
At the same time, take for instance something which is not directly related to medicine. The World Economic Forum, its founder Klaus Schwab, mentioned in his recent publications, The Great Reset and the Fourth Industrial Revolution, that very soon neurodegenerative disease, particularly Alzheimer's disease, will be treated. He is a mechanical engineer. I myself hold a PhD in economics. I'm not a doctor, but I do not say that it will be treated successfully in future. But from your point of view, from your perspective as a professor for neurology, how do you think what should be the alternative ways to deal with Alzheimer in future? Are let's say an alternative approach? May we say that the memory prosthesis is actually something new, or the neuromimetic computer approach, having artificial intelligence sustaining or replacing this cognitive impair of the brain? What are the alternatives? Is it a technical one, or is it a medical one, or is it thirdly, let's say, another alternative dealing with something in society?
Well, I think we've been misleading in our talk so far in trying to say that nothing can be done. From one point of view, we should look at Alzheimer's disease as an aging issue. So we all age, and old people develop problems. Some people it's a loss of hearing, in others it's a loss of eyesight, in others it's a brain disease, it's a heart disease or renal disease, and in some it's a brain disease which causes this. But this doesn't mean that we cannot do anything about it. In fact, there is a lot of that can be done. So, as the old Greek saying was, a healthy brain or healthy mind in a healthy body. So it's important to realize, and many studies have shown that in fact the main risk factor for old age dementia, particularly Alzheimer's disease, are comorbidities that I've mentioned before. So let me again state and emphasize this, that hypertension and overweight and loss of not being actively in physical means, and poor sleep and poor hearing are all risk factors which lead to dementia. So these are things that can be treated and should be treated. So diabetes and so on. So all these are important and should be treated in order to prevent the development of dementia, and if not prevent it completely, then at least delaying it. So looking for your biochemical markers, for example, if you have higher cholesterol level, this is important. This can be treated. If you are diabetic and you're not controlled well, your glucose level are not being controlled well, this is another risk factor. So all this should be looked at. Sleep problems, if you don't sleep well, then this is another risk factor that should be investigated. There are many types of sleep disorders that are associated with the chance of developing dementia later on. So we should look after ourselves, and particularly the older people, but not not the very young, but not the very old either. So it's a middle-age problem. So people who listen to this program were maybe 30 or 40 or 50 years old, this is the important time to look and to prevent the development of these disorders that are so important in developing Alzheimer's disease later on.
So you basically say that falling asleep while listening to us might be healthier than listening to us, in terms of preventing on the long run the risks of the onset of Alzheimer. That a healthy sleep is relevant.
Yes, very much so. So there are many, many issues, but not only the medical ones that I've mentioned, but also social ones. So being active in the community is very important. Many older people, they withdraw from the community. Sometimes the old friends have died or went away, and now they're left on their own and don't have anybody to talk to. And this is very, very important risk factor. So this is something that also we should look at and try to prevent this social inactivity.
What about, as I mentioned, the memory prosthesis systems and all the the neuromimetic computer approach of stimulating the brains in order to postpone the onset of the disease? Could memory prosthesis one day help patients with Alzheimer or other forms of dementia?
Well, I think that this is science fiction. So I don't see anything coming up soon. But let me remind everybody that Jules Verne thought about submarines, and at this time it was still science fiction. It took several decades until this became a reality. So as I said, for now I see this as science fiction, but maybe in the future it will be developed. The issue is really not to make the brain cells act better, but to prevent their death. And preventing the death is important. The death can occur in many different ways, many different forms, and this is in a way looking for the youth fountain to see how we can remain young, and I don't see that this can be solved anytime soon.
Mouse tests confirm that sticky proteins associated with degenerative brain disease can be transferred, but other researchers say that risks for humans are likely to be minimal. What do you think about the risk of transmissibility of Alzheimer?
Yeah, I think this problem has been highlighted many years ago when another important disease, Creutzfeldt-Jakob disease, and other prion diseases were shown to could be transferred from one animal first and then one person to another. This has been investigated, actually led to 2 Nobel Prizes, to Carlton Gajdusek as the first one, and Posner, Stanley Posner later on. And this have shown a very important, very interesting biological phenomenon in which some proteins in the brain of animals or people who were developing these diseases, these proteins became abnormal, and the abnormal proteins were not only damaging the neurons, the cells, the brain cells in which they occurred, but also could be transferred to other neighboring nerve cells, and so it will be infective in this way. I think that this is occurs, of course, in few diseases which are fortunately very rare, but does not occur and has not been proven to take place in humans. So until now, I don't think that there is any danger in treating people who have Alzheimer's disease or Parkinson's disease or any of the other common neurodegenerative diseases.
Well, Gajdusek said that there's no risk of transmitting Alzheimer and Parkinson at all, but later on some scientists have argued that it might be transmissible. I came across a very interesting study about ethics of prion disease, and actually a paper from the beginning of the years 2000. And I was quite astonished to see that the ethics of the prion disease, they basically say that even if something might be transmissible, it's better to keep it discreet at a certain extent in order not to have people panicking, because it might affect insurances, the state of flow, the economy. It might affect the medical system. So at a certain extent, this type of very special disease are, from an ethical point of view, at least according to the opinion of this author, might have other requirements than any other disease, since the risks of social tensions, having this sword of Damocles above one's head, might be very irritating and frustrating. So better playing softballs than having people panicking. Do you think that such ethical considerations would be still valid nowadays? Would you share such an opinion?
Yeah, well, it's an important question. It raises a lot of ethical issues that can be discussed. But before we do this, we have to get our facts right. We have to ask ourselves, what is the risk of contacting one of these diseases when we are exposed to a person who has this disease? And so far, the data do not show any important relationship. There is no risk of contacting with demented or his Parkinson's disease in the fear of developing the disease oneself. No data to show this. So I think that these issues that you have raised are theoretical, and at present I don't think they have any practical importance.
Professor Korczyn, thank you very much for joining me here on Outlook, here on this beautiful Monday in Bucharest. It was a pleasure talking to you, and I hope that the audience had followed this very interesting debate and is at least more aware about the relevance of this disease, which might affect us more in future than it had affected us in the past, and that actually we should take care of ourselves and particularly take care of our sleep, isn't it?
Thank you so much.
Thank you very much, and greetings to Tel Aviv. Bye-bye, Professor Korczyn.
Bye.
Thank you, bye.